So you want to be a hygienist. This video is a substitution to your experience to gaining observation time of a dental hygienist in private practice during this unfortunate time of the COVID-19 pandemic. You will be required to observe the video in its entirety and answer a few questions upon completion. This slide lists the objectives of this PowerPoint. In general, the purpose of this PowerPoint is to supplement your understanding of the field of dental hygiene and to provide a well-rounded understanding of the life of a dental hygienist. A registered licensed dental hygienist's responsibilities go far beyond the clinic. Being licensed rather than just certified requires that the hygienist continue their educational opportunities as a lifelong learner. It also protects the public from unqualified individuals and unsafe practices. As you can see, a dental hygienist's responsibilities in a clinical setting are vast. They perform assessments, process radiographs, remove bacterial biofilm. They also apply cavity preventative agents such as fluoride. In addition, they do things like administer local anesthesia or nitrous oxide. This is just to name a few. The hygienist can take on various roles outside of a clinical practice. As an administrator, we work in settings like promotional programs or oral health, disease prevention programs, educational institutions, or even managed care programs. As a change agent, we may be a lobbyist for legislative changes, a community health agency, or as an entrepreneur, you may just develop a product or program that is beneficial to the public or the hygiene or dental community. To the clinical role of a hygienist is that they are familiar with the dental hygiene standard of care. This requires the hygienist to always perform certain tasks like updating medical conditions and medications, perform an oral exam, decide on individual treatment plans, which may include radiographs. This is important because we do not know what type of cleaning the patient needs or if they require anesthesia until we see the radiographs. Sometimes a patient may need a night guard or sports guard, which requires taking an impression of the teeth, pouring a model, and possibly sending it off to a laboratory or fabricating it yourself. You may need to decide on some preventative measures such as fluoride or sealants. The patient may also need counseling on oral habits, nutritional habits, oral home care, or even smoking cessation. Please visit the following sites for specific information on the clinical responsibilities of a dental hygienist. It is required that a dental hygienist in the state of Maryland complete 30 hours of continuing education credits every 2 years. In addition, they must also complete an OSHA course and CPR course for healthcare providers. Click on the link to learn about licensure requirements in the state of Maryland. In terms of potential certificates or degrees, the certificate and associate's degree is considered the entry-level degree for dental hygiene. As you move further into your education, a master's or doctoral degree focuses more on education, research, or administrative positions. Next, you will observe a short clip on the life of a dental hygienist. Please answer the following questions indicating your overall understanding of the industry of dental hygiene. Thank you for taking the time to view the PowerPoints.